we presented data from our center here at City of Hope on 600 patients that were older adults aged greater than or equal to 65. And they were randomized in a 2-to-1 fashion to receive something that's known as GAIN, or geriatric assessment-driven intervention, versus standard of care. And the primary endpoint here was an overall reduction in grade 3 to 5 toxicity in these patients. And we also looked at hospitalizations, length of stay, as well as advanced directive participation, because these are important outcomes for older adults. So a little bit of background on this study is that previously we had shown and developed a geriatric assessment, which is essentially a questionnaire that older adults fill out when they're going on their cancer journey. And what we found was that when we asked older adults to fill out this geriatric assessment, we were able to detect additional vulnerabilities that we might not find in our traditional oncology practice with measures such as KPS or ECOG performance status. And we were able to show in our group that previously, if you use a geriatric assessment compared to those traditional measures of KPS or ECOG performance status, that the geriatric assessment can predict toxicity much better compared to those traditional measures. So this GAIN study that we presented was a step further in the sense that all the patients filled out a geriatric assessment, and then for those patients that were in the GAIN treatment arm, we were going to intervene with a multidisciplinary group of providers to see if we can then minimize toxicity based off of intervening on vulnerabilities that were detected on the geriatric assessment. And what we reported at ASCO 2020 was that there was indeed a significant reduction for those patients that were randomized to the GAIN arm compared to the traditional standard of care arm. And this was across all tumor types. This was across all different ages of older adults. It was very balanced, and then across all different types of chemotherapy regimens. So what this shows was that because we were able to reduce toxicity by 10% in terms of grade 3 or 5 toxicity in the GAIN arm, this really shows that in standard practice, we should be implementing this geriatric assessment and then intervening, because if we do that, then these patients are going to be able to tolerate treatment much better without really losing any efficacy whatsoever. So this is a key finding, and I think this is one of the first randomized controlled trials to look at geriatric assessment interventions, and really puts us in a pivotal point right now to advance this care and potentially make this the new standard of care moving forward.